Good afternoon. My name is Dr. Soki. I'm the Program Director for the Internal Medicine Program here at the Medical College in Aga Khan University, East Africa. Its mission is to be the best internationally recognized site in the country in each of our three pillars, which is patient care, education, and research. The department is comprised of specialists in the field across all the specialties, almost 27, who are dedicated to this cause, and supported by fellows in cardiology and infectious diseases, as well as other fellows rotating from regional colleges such as nephrology. What do rotations involve? There are 7 inpatient and outpatient teams. Each team has a senior resident and a junior resident, and you may have medical students, interns, and family medicine trainees with you, and you're supervised by the respective faculty of each specialty throughout your rotation. Cardiology there in green is the only standalone rotation. The rest are all combined. Pulmonology, gastroenterology, nephrology, endocrinology, hematology, oncology, palliative care, neurology and general internal medicine, infectious diseases and dermatology, psychiatry and rheumatology. We also have external rotations in the outpatient medical clinic, emergency medicine block in the first year, and critical care rotations throughout your program. But we are unique in that we also offer self-designed elective blocks as well as research blocks that are dedicated to your dissertation topic. So what do your rotations look like? Up there in the mustard is the first years, and in lilac are the second years, and you can see for the first years throughout the year they spend at least 3 months in the rotation, and we choose first the very general medical specialties, and you have critical care and accident and emergency interspersed. In the second year we start to introduce the elective blocks, research blocks, and the psychiatry and rheumatology rotations, and this is all mirrored in your senior years and your third and fourth year, where we now also introduce the outpatient clinic block. Your progress is judged on more than just your exams, which is highlighted down there in red at the bottom. And we look at all the 6 major categories as highlighted here: how you perform throughout your clinical rotations based on faculty feedback, how you do your work-based assessments and how many you have done, feedback on your presentations and teaching and your attendance, how you're progressing with your dissertation, any other audits that you may have done or publications that you may have submitted, and your end of module continuous assessment tests, in addition to the end of year eligibility report. How do we deliver our teaching? On the left here is the specialties that we rotate through over a 2-year cycle. That's delivered as modules, and we're unique in that we do the teaching as a dedicated, time-protected, weekly academic afternoon once a week in the lecture theatre with the respective faculty, and we also do a flipped classroom model. This means that the lectures that have previously been done on the same topics are already available in the virtual learning environment online through our medical college website, and you therefore have the opportunity to read through the material and analyze it and learn it, as well as then be able to apply it now clinically in these lecture theatre sessions with the faculty and make them more case-based and clinically relevant, so that they're more applicable to your day-to-day practice and learning. But there are other opportunities as well: small group teaching, bedside teaching and problem solving, one-on-one clinical teaching in the outpatients, and clinical skills teaching. But the other opportunities are case-based discussions on ward rounds, grand rounds, weekly mortality meetings in our department, multidisciplinary team meetings in certain specialties such as respiratory, neurology, and the neurosciences and oncology, as well as online modules and lectures. What makes us unique as a department? In terms of education, we are an MRCP International Testing Center, the only one in Sub-Saharan Africa. We also have applied for American accreditation of our program. Clinically, we are the largest department in terms of admissions and outpatients. Our junior residents, they work on a shift system when they're on call to avoid fatigue, and our department has been on the forefront of COVID-19 care since the outset. In terms of research, our residents have won the best research prizes in the university in 2019 and 2020, and our department is a significant annual academic publications output contributor to the university. This is the team that supports the entire residency program: our chair, Dr. Kuniha, the vice chair, Professor Syed, a very capable administrator, Maureen Monjiku, and myself as the program director. And we support residents throughout their training, including through this departmental residence training committee, which is comprised of myself, residents from each of the training years, as well as the chief resident. And we meet monthly to discuss training and work issues, which are then fed back to the leadership team to smooth them out and make the experience better. We also attach each resident to a faculty mentor, more than just a supervisor, to support them through the training on a day-to-day basis. And we're more than just clinical work and teaching and research. We like to do team working exercises and build some camaraderie across us. For example, tree planting exercises. We encourage our residents to attend local meetings organized by the respective faculty, such as a diabetes meeting, to fundraise for certain illnesses and patient groups, such as climbing up Mount Longonot. And we like to celebrate milestones such as birthdays with our residents. With that, we welcome you and we thank you. Please feel free to visit their website for any further information.